The abdominal cavity is situated between the chest and the pelvis and contains many organs, including the largest part of the gastrointestinal tract. Most of these organs are covered with a thin layer of cells. This layer is called the peritoneum. The peritoneum holds the abdominal organs in place, facilitates movement of the bowels, and helps to protect against infection. Unfortunately, the peritoneum may also be invaded by cancer cells. This type of cancer is usually referred to as peritoneal cancer and affects hundreds of thousands of patients each year. In peritoneal cancer, there are 3 possible origins of the cancer cells. First, cancer may arise from the peritoneum itself, resulting in a very rare disease called malignant mesothelioma. The second possible cause is a mucus-producing tumor, a mucocele, most often situated in the appendix. The resulting disease is called pseudomyxoma peritoneae, a rare subtype of peritoneal cancer. Finally, and by far the most common cause of peritoneal cancer, is a metastatic spread from a malignant tumor elsewhere in the body, most frequently colon cancer. Colonic cancer typically starts in the inner layer of the colon, but in advanced cases, the cancer may infiltrate all layers of the bowel wall, including the peritoneum. Then, tumor cells may shed into the abdominal cavity and cause peritoneal cancer. Peritoneal cancer is often accompanied by the formation of large amounts of fluid accumulating in the belly, called malignant ascites. If left untreated, life expectancy is usually short, and most patients will die from this disease within months after diagnosis. Not so long ago, treatment of peritoneal cancer patients was thought to be impossible. Recently, this has changed, and various hospitals around the world now offer treatment for selected peritoneal cancer patients. This treatment strives to radically remove all cancer cells, and by doing so, offering long-term survival or even cure to the patient. The HIPEC treatment starts with an operation during which all visible cancer cells are surgically removed. It is inevitable that microscopic tumor cells are left behind, and if untreated, these cells will cause peritoneal cancer again. To destroy these invisible tumor cells, the abdomen is filled with a very high dosage of chemotherapy during the same operative procedure. The chemotherapy is then heated to 41 degrees Celsius to increase its effectiveness. This is achieved by a dedicated perfusion device capable of heating and circulating the chemotherapy for 30 to 90 minutes. This is called hyperthermic intraperitoneal chemotherapy, hence the name HIPEC. Most patients remain in hospital for 2 to 4 weeks after the operation. After recovery, additional chemotherapy with pills or infusion may be advised for selected patients. Although the HIPEC procedure strives to remove all cancer, cure is not possible in every patient. Prognosis after HIPEC is influenced by many factors, but generally speaking, survival is expressed in years instead of months. In many countries, HIPEC is now routinely considered in patients with peritoneal cancer, from colorectal cancer, malignant mesothelioma, and pseudomyxoma peritoneae, and sometimes for other indicators. Unfortunately, not all these patients qualify for a HIPEC procedure. Whether or not an individual patient may benefit from a HIPEC procedure depends on many factors, such as age, general condition, origin of the peritoneal cancer, and severity at the time of diagnosis. Therefore, it is desirable that a patient diagnosed with peritoneal cancer should be counseled by a medical specialist experienced in the treatment of peritoneal cancer in order to define the optimal treatment strategy in each individual patient. Further information may be obtained at hipec.com.